This is your Town of Islip Supervisor, Angie Carpenter. Welcome to Supervisor Spotlight. And we're delighted to have as a guest today a returning star of Supervisor Spotlight, and that's Dr. Chris Rayo, who is Head of Emergency Medicine for Catholic Health and Good Samaritan Hospital in particular. Thank you so much for being here.
Thanks for having me.
He has been with us from the beginning of the pandemic when we first had a little seminar, tutorial kind of session and updates on Supervisor Spotlight. And I really do appreciate it, I really do, and all that you do and all that Good Sam does in the system and everyone in healthcare. It's been absolutely extraordinary, really.
Well, thank you.
So where are we? Where are we? You know, just as an aside, we had seen each other at a press event announcing the transition of the vaccine site in Brentwood from a vaccine site to, from a testing site rather to a vaccination site. And I said, yeah, you should come back on the show, you know, just kind of give a little update on where we are after the year and everything. And now things are like changing. So we really need you here to update us on what's going on.
So I think the vaccine site is actually a great segue into where we are today. I think in this region, we're actually in a much better place than other parts of the country. And it's primarily due to the vaccinations, which I'm sure we'll touch on a little bit more later. In other parts of the country, we are seeing major rises in hospitalizations, even in some cases ICU. Admissions here, we're not seeing that as much. So if you look at the numbers, you're seeing a slow trickle up, but we're kind of keeping it at a steady level in terms of hospitalizations. We are seeing, you know, more positive cases, but generally the patients aren't as sick. We are seeing vaccinated people come in who are positive as well, but again, I think the real take-home from the vaccine is that when these people are getting it, they're not getting as sick, which is, I think, what we all care about the most. So I think generally we're in a good place. I think the vaccination piece is really the key. You know, that's really our primary weapon against this, and the more people that get vaccinated, everybody benefits.
Yeah.
So,
you know, with the vaccines, let's talk a little bit about that. You know, there are people that the minute they heard a vaccine was available, yeah, sign me up, you know, I want to get a vaccine. And, you know, I was one of them. As soon as I could, you know, qualify, I wanted it for a number of reasons. I just don't want to miss work. I want, you know, I don't want to infect anyone else. So for, like I said, a number of reasons, but there are those that are adamant that they just are not getting the vaccine, you know. So what do we do? What do we say to them? I know some governments, some entities are offering incentives, but I don't know that that's the answer really.
yeah, I mean, I think that the whole vaccine hesitancy, you know, a lot of people thought that maybe this was rushed, and it wasn't really rushed. It went through the same rigors that any other vaccine being developed. It's just that, you know, we've gotten better at vaccine development because we have vaccines for so many other viruses. You know, I think, again, it's do you want to get really sick with this? Do you want to potentially die from this? And the vaccine protects against those two things. You know, if you don't want to be hospitalized, you should get the vaccine. If you don't want to become terribly ill, you should get the vaccine. If you don't want to die, you should get the vaccine. You know, we haven't around here had as much challenges as other parts of the country, which I think is great, but we're still teetering in like the 2/3 of people fully vaccinated. You know, we'd really like to see that number much, much higher. And, you know, I do think those other parts of the country are going to catch up because they're starting to see what happens when people are not vaccinated. And I know there's a lot of, you know, medical professionals, physicians speaking out in those areas of the country, you know, telling stories and letting people know if you're not vaccinated, you're not as protected as somebody if they have gotten the vaccine.
So talking about telling stories, you know, anecdotally I've heard, and one case in particular just recently, of someone who has been vaccinated who tested positive for COVID. They were at an event. You know, some of the people that were there wound up getting COVID, so everyone who attended the event was notified. So the person who had been vaccinated, who had no symptoms, you know, on the side of caution and probably curiosity, decided to go get tested and wound up testing positive. So how do we explain it, or can we not explain it? Is it just all too new to even figure it out at this point?
No, again, I think it's, first of all, unfortunately, that's not uncommon. You know, we're seeing people come in all the time who either have a sniffle or they're a little congested, you know, and they're testing positive and they're vaccinated. It certainly can happen. Again, if you're vaccinated, it doesn't mean that you can't contract the virus. It just means that there's a much lower likelihood that you're going to get very sick, be hospitalized,
Or
go
die.
to the ICU, or die.
But so, and just kind of my own curiosity, is it possible that because you've had the vaccine and you have the antibodies, when you're being tested and you've got no symptoms and all of a sudden it tests positive, is it because you've had the vaccine? No?
No.
Okay.
I mean, yeah, it's wishful thinking, I guess.
Yeah,
but,
it is.
You know,
That's
you know, positive is positive. You know, the other piece of this that I think is scaring people a little bit, especially, you know, more recently in the last week or so, is that those individuals can spread the virus as well. So, you know, if I'm vaccinated and I contract the Delta variant, for example, there is a chance that I can spread this, which has initiated some of the new mask guidelines that are now coming out.
So, with spreading it, and it just brings to mind children. Up until now, and now too, hopefully, it seems that children are more resistant to COVID. Is that still the case?
Definitely still the case. You know, I think kids are, you know, much lower risk of getting sick. You know, we've spoken before, I have 2 young kids, and I'm, you know, fairly comfortable with them doing, you know, 99% of normal activities. You know, assuming they're healthy, of course, you know, no comorbidities, no other illnesses, et cetera. So we're still not seeing a spike in the number of kids coming in, you know, critically ill. You know, can it happen? Yeah, of course, you know, but you're talking about super, super low numbers and percentages.
Has there been any recent developments or talk about vaccines for, because right now it's 12 and older. Is there any talk about that threshold age being lowered?
Yeah, I mean, there's always talk until
especially school age,
yeah,
you know.
until something comes out, we'll see. It wouldn't surprise me if at some point that age level got lowered. But again, speaking now as a parent, you know, assuming your kids are generally healthy otherwise, I think the risk level is still very, very low.
Okay, well, that's encouraging. That's really encouraging. The Delta variant, you mentioned it, from what I've read, and maybe you can shed more light on it, seems to be more contagious than original.
Yeah, so the Delta variant is what they call a variant of concern, which basically means that there's potential that it gets spread more easily, that somebody who's vaccinated may be less protected against it, that you might get sicker from it. And currently the Delta variant, it's what we're seeing the most cases of. So in New York City, which, you know, they have a very good data set and it's very easy to determine which variants are causing disease there. About 73% of cases are the Delta variant. Now keep in mind, not everybody who gets tested, they're testing to see which variant it is. So, you know, maybe 12 to 15% of cases they're looking at, but still. So a very high proportion, and nationally we're seeing higher numbers of about 83%.
So with that, we're going to take a little break here on Supervisor Spotlight with our guest today, Dr. Chris Rayo. Islip Supervisor Angie Carpenter on this edition of Supervisor Spotlight. And today, as our guest, we have Dr. Chris Rayo, who's the Director of Emergency Medicine for Catholic Health and Good Samaritan Hospital in particular. And as I said earlier, he's just been absolutely wonderful and very gracious and generous with his time as we've been traveling through this world of COVID. Talked a little bit about it earlier, and we'll touch on it again later in the show. But I would like to talk to you more about what's going on with other things health-wise. And I know that especially in the beginning with COVID, people weren't getting, their normal screening physicals, appointments were being canceled, and little by little, people are slowly getting back to that. Some of the protocol seems to still be in place with doctor's visits requiring people to wear a mask when they come in. So if you could, give us a little bit of what's going on.
Yeah, so I think you're right. I think for a pretty extended period of time, it was all just COVID. A few times on this show, we tried to get out to people that if you have other symptoms or concerns or other comorbidities and illnesses, you really need to continue treating yourselves for those things as well. I think for the most part, things are now back to quote unquote normal in terms of medical care. I hope everybody's going to see their primary care physicians, their cardiologists, other specialists, etc. And things are pretty much ramped up, and everything is rolling as usual. And I think it's still important for people to know that the medical care that they're going to receive in a hospital and a doctor's office is safe, and they need to follow up as they would have previously prior to COVID.
I think the lesson I'm hopefully learning and taking away from all of this is that COVID came upon us out of the clear blue. It seemed it just seemed to happen. And initially it was like, okay, a couple of months from now, this is all going to be over.
Right.
And I don't know, I'm starting to think that it will never be over. COVID will be with us, just like other diseases and issues have been with us over the years, and it's something we're just going to have to deal with.
Yeah, it could be. It could be, that we're getting booster shots on a yearly basis, But again, as we learn more and more and do further research, we'll have medications that will be helpful in the future as well. So, we'll definitely be in a better place.
And some of the protocols and way we were functioning on a day-to-day basis during COVID, we saw that there was a tremendous decrease in the number of flu cases. So maybe it wasn't such a terrible thing to get people a little bit more focused on good hygiene, washing their hands, and not feeling like you have to be on top of one another, keeping that good social distance.
Yeah, I think that obviously not too many people are thrilled about the mask. That certainly had something to do with it, but like you said, even if we're not wearing masks, there's other things, hand hygiene being, number one, a little bit of social distancing. Those things will all help against the flu and other infectious diseases.
And maybe with the Delta variant on the scene and the slight uptick that we're seeing, I get the sense in just the world I travel in that people have started getting a little bit more lax, where they weren't shaking hands, they weren't hugging, and believe me, I'm a hugger, and they were being a little bit more cautious about those kind of interactions because you just never know.
Right.
But it seems, and I had an instance the other day, someone said to me, "Have you been vaccinated?" And I said, "Sure." And then he leaned over and gave me a hug and a kiss, and I'm like,
Right.
There was a part of me that, kind of,
And
held
sometimes
back
you
a
get
little
into
bit.
An awkward situation
Exactly.
where you don't know if
Right.
if the
So
other-
that maybe, it's not such a bad thing, and maybe we need to kind of ratchet it back a little bit and be a little bit more cautious and careful, because here we are, it's the middle of the summer. Before you know it, it's fall, and we're in the throes of flu season again. And we don't want it, would like to keep it that we had minimal amounts of flu and hopefully minimal amounts of COVID, because we're being cautious and careful.
Yeah, I do think we're at sort of a point where we need to just take a deep breath and just, fall and winter, like you said, are coming up. I mean, if you remember back to last summer, we were in a pretty good place, and then we had
and then we went up in November. The numbers started going up.
Right.
Yeah.
So we have to be cautious. I mean, we don't have to be depressed and pessimistic, and but we definitely have to be cautious and maybe do some of those very basic things: hand hygiene, social distancing, a little bit more, just to see where we're at. Again, I think in this area we're at a pretty decent place. Not the best place in the country, but we're in a very good place.
Certainly not the worst.
Not nowhere
Certainly
near the
not
worst.
The worst, thank God.
So we're doing a good job. Everybody just still needs to be aware of what's going on.
Yeah, and those practical, hygiene tips or strategies or part of everyday life. You see kids have been taught well. Sneeze into your arm, not into your hand, and then you go to grab somebody's hand.
Absolutely.
And I'll see adults doing that, sneezing into their hand, and I'm like, your arm.
Yeah, I mean, I think, we just have to be aware of the current environment and be careful, be respectful of everyone else, obviously. But at Good Sam, I think we're definitely moving forward. Care is pretty much ramped up to normal, both with our private offices and the hospitals. We have a brand new pediatric emergency department. We're starting to see kids come back more, which is great. If they need to be seen, we need them to come in.
Right. So you're talking about a new pediatric department. I know there's a lot of exciting things, and we're going to take a little break, and we will be back with Dr. Chris Rayo from Good Sam, Catholic Health, and a regular here on Supervisor Spotlight. Hi, this is your Town of Islip Supervisor, Angie Carpenter, with the latest edition of Supervisor Spotlight. And today we have with us again our good friend, Dr. Chris Rayo from Good Samaritan Hospital, Catholic Health, heads up the emergency department and has his pulse on what's going on in healthcare in our community. And, before we went to the break, you spoke a little bit about the pediatric department at Good Sam, and that's so huge, brand new, separated from the regular ED. Talk a little bit about how that's going now.
So I think it just provides a much higher level experience for both the patients, the kids, and their families. It's a brand new, beautiful facility with private rooms that really enable us to give the patients the care that they deserve and gives family and the patient's privacy, which is very important.
So even in the emergency department, you do want that privacy, and it's important for kids. It's a scary thought to be going to the hospital for any of us, really, but really for kids.
Yeah, particularly for kids, even if they have a minor, what I would consider a minor concern. It's obviously a very stressful time to be in an emergency department. So this just provides a much cleaner, comforting environment, and we think a much better experience for our patients.
Yeah, that's great. So you talked about private rooms in the ED. There are some plans in the works at the hospital, and maybe you want to share some of that.
Sure. So we're actually super excited that we have plans for a potential new patient care pavilion, which would provide us with a brand new emergency department with all private rooms, state-of-the-art technology, imaging, et cetera. And then there would be brand new operating suites right above us, and then patient care floors above that. We're not planning for more patients, the plan really is to give patients and their families a much better experience, much smoother flow to get patients who are really critically ill from the emergency department to the operating room if they need be. There's an elevator that goes right up. The other thing is, Long Island's a beautiful place. It's an unbelievable place to live. I was born and raised here, but to recruit really top high-end physicians, we need to be providing them with the facilities and the technology, et cetera, that they want to practice in that type of environment. And this new patient care pavilion would do that, and it would be a real plus for us to bring in top-level talent to really provide the care to the community that we want to provide.
That's very interesting when you talk about that. Certainly the standard of care in the industry is for private rooms, and that's something that has been lacking in this region. So you're not just talking about private rooms in the ER, but throughout the hospital, so that
correct.
the experience is you're in a room by yourself, you're being cared for, the person in the next bed who is up all night, coughing, sneezing, yelling, whatever, you don't have that. So the chances for a person getting through their hospital stay quicker and more efficiently and effectively is better in their own environment. So that's great. But I didn't think in terms of the recruitment of staff, and that's important.
Absolutely. And again, we're not planning for more patients. We just want to provide better care and a better experience. I think, Good Sam has an unbelievable clinical staff, from physicians, nursing, leadership, et cetera. It's really some of the best physicians I've ever worked with or ever met. And this new patient care pavilion would really just match the environment to the clinical staff, and it's something that all of us as doctors we're really, really excited about, and I think the community should be excited about it too. If they have to go to the hospital, this is going to provide an unbelievably upgraded experience to what we're able to do now. We do the best we can in the current environment, which is still great, but this really is going to bring it to another level.
Ratchet it up a notch. Yeah, that's really great. We're really blessed, and I know you're not going to mind this because I know that you always work collaboratively with the other medical institutions, but in our town of Islip, we're the third largest town in the state of New York, but we have 2 first-class medical facilities, South Shore University Hospital, part of the Northwell system, and certainly Good Samaritan Hospital, part of Catholic Health in our town. Easily accessible from any part of our town, really. So
yeah,
we
absolutely.
really, really are blessed.
I actually had a call this morning with the chairman of emergency medicine at South Shore University Hospital.
Taking a little getting used to with the name change, but
I agree. I mean, we're constantly sharing things, and particularly during COVID, it was important for us to know what was going on down the block. Sharing things that could potentially benefit the community, and we're certainly open to doing that on both sides.
Yeah, well, really both institutions demonstrate that commitment to community. Good Sam, during COVID, not just the fact that you've made yourselves available, you yourself, the infection specialists, I mean, they've been really wonderful. But on a lighter level, Good Sam stepped up to the plate when people couldn't do the kinds of things they did recreationally during COVID, came out and sponsored our drive-in movie series, which was so popular, so much so that we repeated it again this summer. We're still in the middle of the drive-in movie series, and that's a popular family. Every week we're seeing upwards of 200 cars come to the drive-in movie, and many times it's kids that have never experienced a drive-in movie before. So that's really is huge. And certainly during COVID, when we did not have the testing site in Brentwood, a hamlet that unfortunately experienced a larger percentage of COVID cases. I mean, out of a population of 60,000, there are really almost 12,000 cases of positive COVID. That Good Sam came in with a grant that we got from the Community Development Agency, established a testing site, and about a month or so ago, it was converted to a vaccine site, as I said
Yeah, I
earlier.
think super important to target those areas particularly that saw high case rates, target them for vaccinations as well. It's very logical, but I think that'll be very effective.
Well, sometimes the most logical thing escapes everyone's. But we, because of Good Sam, we were able to do it. And I just want everyone to be aware of that. It is Wednesdays, and it's at the Brentwood Recreation Center. It's a tent. It's a drive-through. It's the only drive-through vaccination site on the South Shore of Long Island, really, at this point. And you just need to call to make an appointment. And occasionally, if it's a walk-up, they can be accommodated depending on the number of people who have signed up. But that number is 631-376-3224. So 376-3224, and call, make that appointment. It's Wednesdays from 1 to 5 p.m. And if the need is there, if we get a lot of requests for more, Good Sam has given us a commitment that they will expand the hours and or days of the vaccinations. So, we're really very grateful for that.
Well, we're happy to support the community and, get vaccinated. It's very simple message.
That's it, We're here, as I said, the middle of the summer. Before you know it, kids are going to be going back to school. There's a bit of debate back and forth on what those mask mandates are going to be, and we're looking at that. But the more people that are vaccinated, the more people that are protected against a serious outbreak of COVID, or landing in the hospital, or dying from the disease, and we've lost thousands of lives, in this area because of COVID, and we don't want to see another life lost.
Absolutely.
So before we end today's show, do you have anything else you want to add?
I think, again, it's simple. Everybody who can get vaccinated should be vaccinated. That, again, is our primary weapon against this. And the more people that are vaccinated, the better outcomes we're going to have, and the quicker, hopefully, we could get through this.
And that was unsolicited. I didn't ask you to, pump up the vaccines, so I appreciate that. But, when I've encountered anyone that, I'll say, well, what do you mean you haven't been vaccinated? Why? And I don't know. And, they usually hem and haw. And I go, have you checked with your physician?
Right.
Have you asked your doctor whether or not it's safe or whether or not you should have the vaccine? And 9 times out of 10, no. So I said, why, before you make that decision on your life, on your health, why don't you check with your doctor and see what he or she says about getting the vaccine? So maybe, if nothing else, if anyone's out there listening, watching, and you haven't been vaccinated, ask your doctor and then make the decision.
I think that's a great point. I get calls all the time from friends and, friends of friends asking about the vaccine. And usually I'm successful in kind of persuading them. But, call your primary care physician who you've known hopefully for years and have a discussion. I think that's a great tip.
All right, so there you go. You heard it here first or second or whatever. I'm sure you're hearing it. Get vaccinated. So, Chris, really thank you so much for being with us.
Thanks for having me.
For those of you who are listening and watching, we thank you. Be safe.